Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is May 3rd, 2025. This video is in a Lancet article initially published on March 30th, 2025 online and in print on April 26, 2025. It's about the FAME-3 trial. It's the outcomes after fractional flow reserve guided PCI versus CABG, a 5-year follow-up of a multi-center open-label randomized trial. There was an accompanying commentary on this paper. The FAME-3 trial compared FFR-guided PCI using modern drug-eluting stents versus CABG in 3-vessel coronary artery disease, excluding left main disease. Modern advances in PCI and surgery demanded reassessment of outcomes over 5 years. The goal was to evaluate death, stroke, or myocardial infarction rates. It was a multi-center open-label randomized trial with 48 hospitals across the world. 1,500 patients were randomized, 757 to PCI, and 743 to CABG. The primary endpoint was a composite of death, stroke, or MI at 5 years. The key feature was FFR-guided PCI using zotadalumab-eluting stents. High medication adherence was ensured. What did they find? No significant difference in mortality, stroke, or MI between PCI, 16% in the PCI group, versus CABG, 14%, hazard ratio 1.16, p-value 0.27. Higher MI versus 8% in the PCI group versus 5% in the CABG group, and higher repeat revascularization, 16% in the PCI group versus 8% in the CABG group. Mortality and stroke rates were similar across groups. There was no late catch-up benefit favoring CABG between 1 to 5 years. Key takeaways: PCI and CABG outcomes are now closer than ever thanks to better techniques and therapies. FFR-guided PCI increased myocardial infarction and revascularization risks, but not death or stroke. Decision making should emphasize patient anatomy, risk profile, and preference. FAME-3 reshapes our understanding of revascularization in multivessel coronary artery disease. The accompanying commentary praised the FAME-3 investigators for their excellent 5-year outcomes, strong medication adherence, and balanced trial design. The key point was PCI narrowed the historical gap with CABG, but still showed higher MI and repeat revascularization. The critique: landmark analysis after 1 year suggests no late mortality gap, but cardiovascular death data was missing. Low multiple arterial graft usage, only 25% in the CABG group, and this may underestimate its true advantage. There was patient selection bias. Lower syntax scores may have favored PCI. The key takeaway: CABG remains preferred for low surgical risk candidates. Heart team discussions are vital for real-world decision making. Final word: a 10-year follow-up is needed to truly see if PCI can bridge the historic divide. Podcast brought to you by Master MedFacts at mastermedfacts.com.